Your mind was ballot measure 110 a mistake?
No, I don't think I'd go as far as to say ballot measure 110 was a mistake.
Take a walk around downtown Portland and look at the drug-addicted people who are sitting there out of it. And don't tell me that this program has succeeded.
That was ABC's Ajin Singh reporting from Oregon on the state's ballot measure, which will recriminalize the possession of small amounts of hard drugs. The Democratic governor there signed a law that will reverse parts of a voter ballot initiative that relaxed certain penalties for drugs. The original measure that decriminalized certain drugs was approved in 2020 with bipartisan support. It made the personal use and possession of heroin, cocaine, and methamphetamine punishable by a ticket and a maximum fine of $100. It was part of Oregon's landmark plan to focus on treatment over punishment, hoping it would create a new model for drug policy around the country. But after an uptick in overdose deaths and frequent instances of public drug use, the chaos on the streets of Portland, Oregon has reversed course, and that is our policy. That is our spotlight today. Let's bring back our panel, LZ, Alencia, John, and Mike. LZ, I want you to start us off here. This measure passed in 2020 with wide bipartisan support, and now we're seeing bipartisan support pretty much in the inverse here. What went wrong in Oregon?
They didn't have a policy that addressed the after effect of reversing decriminalization. They were short tens of thousands of workers around the state that was necessary based upon studies to help prevent what we're witnessing right now, meaning mental health professionals, people who could be contacted in case people found themselves addicted. According to studies now, Oregon was short nearly 30,000 staffers. So you can't go and say, it's a free-for-all on one end and not be prepared for people who may overdose or may need assistance in the back end. So if there's a failure aspect for it, it was the simple fact that they weren't prepared in terms of having enough people to help Oregonians if they became addicted.
Well, and John, as a former prosecutor here, was there a case to be made for lesser penalties for simple possession?
Absolutely. Listen, I was a prosecutor for 20 years, and we never went after drug users. It's drug users that are committing crimes is what you went after, and the drug traffickers who peddle the poison. But let's face it, this is a matter of life and death. There's a lot more deaths because of what happened. LZ is spot on. The drug issue is prevention, it's treatment, and it's law enforcement. You need all three working in a fine symphony or it's never going to work. And one thing that no one's really talked about is drug courts work. Drug courts have a tremendous amount of success as an alternative to incarceration and an alternative to punitive sanctions. And so I think Oregon failed for exact reasons LZ said. And, he's right in that regard, no doubt.
Well, and kind of to this theme that's arising now, Alencia, some say that city and states don't do enough to implement treatment and addiction recovery programs. What do you say to that? What should be done?
Well, I think just as much as we focus on the policy around decriminalization, we have to focus on policy that provides funding for these public health programs that would help people. Because a lot of people don't have the amount of money that it will cost to have mental health treatment, whatever it may be. And so we have to actually fund the infrastructure to absorb the need here. Going to what LZ had said, all of these positions need to be filled, and I would say overstaffed as we are decriminalizing the drug. We have to make sure that we are ramping up the efforts to make sure that people are healthy.
Well, and Mike, with this policy, initially, Oregon was trying to chart a path for the rest of the country to follow. But now with it basically going in the inverse, does that send a signal to other states?
I don't know if it necessarily signals to other states, but what it does signal to other states is be mindful of the course correction. When you're trying something new, you have to give time for things to go wrong. And oftentimes when things go wrong, when we try and fix an issue, we end up overcorrecting and making the problem much worse. This is a public health crisis. This isn't a criminality dynamic. And you can't criminalize addiction. Addiction needs to be treated, not criminalized and punished within the legal system. What Oregon needs to do, as well as the rest of the nation, is really get serious about how the drug supply is actually entered into the United States. By them focusing on low-level criminals with small amounts of drugs, those are the ones who they're low on the supply chain. They need to go after those who are actually supplying in bulk of the drugs to get rid of the amount of drugs on our street, not criminalize a disease and addiction. That doesn't help the case whatsoever.
If I can quickly just add that,
Sure.
Decriminalizing marijuana is very different than fentanyl or heroin or everything else. We also need the science to drive the decisions and not group everything together just because it's under the umbrella of recreational drugs.
That's a very important point. LZ, Alencia, John, and Mike, thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.